All right, welcome back to ABA Exam Review, where we're going through our fifth BCBA practice exam together. As always, if you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our practice exams, study guides, and our combo pack. When you pass, let us know so we can include you in our Sunday shout out. Work hard, study hard. Let's get going. 31. You are asked to design a performance monitoring program for newly hired behavior technicians. The program should be comprehensive in nature. You decide that you will provide all technicians a $50 bonus every 6 months if their performance is strong according to the plan. Is the $50 an acceptable reinforcer? People tend to struggle with personnel management, with performance monitoring, staff training. All of these ideas give a lot of people trouble, especially if they've never been in, say, a manager or a boss role. What you need to remember about the task list and the exam is they want you to approach personnel management the same way you would approach a client, right? Client management. You're going to follow those steps where we need to do things like identify goals, identify target behaviors, reinforcement systems, preference assessments, reinforcer assessments. Human behavior is human behavior. So just because these are your technicians or staff doesn't make it different than when you're working with the client. So in this case, you need to design a performance monitoring program for newly hired technicians. You say, well, I'm going to give a $50 bonus every 6 months if their performance is strong. The question wants to know, is that an acceptable reinforcer? Now, be careful, right? Is that an acceptable reinforcer? Well, what do we know about choosing reinforcers? We know we need to individualize it because what reinforces me might not reinforce you. Some workers might want money. Some might want more time off. Some might want promotions. We're not sure. So is the $50 an acceptable reinforcer? A, yes, this would be an adequate reinforcement system to use for technicians. That's a very sweeping statement. If you have 10 technicians, maybe 6 of them want the bonus, but 4 of them want something else. A is very sweeping and very generalizing and very strong, right? So A is a little too strong. We can't say for sure that this is a good system for all technicians. We don't know yet. B, no, $50 is not enough to incentivize technicians. Again, we don't know. We don't know if A and B are true. And why not? Because we haven't done our assessment. Just like with the client, you can't walk in and say, well, now the toy truck is going to be your reinforcer. What do you have to do? You've got to go through preference assessments. You've got to go through reinforcer assessments. So C, maybe a preference assessment should be conducted first, is correct. You need to do a preference assessment. What do you guys want? What do you like? And you do a reinforcer assessment. Does that thing change the behavior? We're not even close to understanding if that money is a reinforcer yet. And then D, no, money should not be an incentive for good technician work. Well, it's not for us to decide. If money's the incentive, money's the incentive. That is what's going to change their behavior. What's it going to change their behavior? Just is what it is. So really, we're just not sure yet because we haven't done any sort of assessment. So the first thing we need to do is conduct a preference assessment first to decide, is this a potential reinforcer? And then we can do a reinforcer assessment to determine if it's acceptable. 32. Brian's teacher explains to you that Brian puts his head on his desk for attention. This behavior is put on extinction, and the replacement behavior of keeping his head up is taught. This intervention is effective, but now the teacher is withholding reinforcement for Brian keeping his head up, and Brian is putting his head on his desk again. What does this describe? Now, you might have noticed even I got a little tongue-tied reading that. The long question seems to be a lot of information. When you get questions like this, the last thing you want to do is jump immediately to the answer choices and trying to figure out what the right answer is. That's so much information. We've got to do all our work in the question before we can evaluate answers. So first, question is asking what? Well, it's asking about this phenomenon, about Brian and his behavior. What does this describe? Well, we know Brian is putting his head on his desk for his attention. They put the behavior on extinction. Teacher replacement behavior, keeping a head up. Intervention is effective. So we know extinction was effective. Behavior is extinct. And we know he got taught a replacement behavior of keeping his head up. However, the teacher is now withholding reinforcement for Brian keeping his head up. And now Brian is putting his head on his desk again. So a couple key points. 2 things should be on your mind. You should either be thinking spontaneous recovery or resurgence. A, resistance to extinction is not going to be correct because extinction was already effective. D, extinction burst, again, we're post-extinction. We're long past extinction being effective. So what's the difference between resurgence and spontaneous recovery? Well, with spontaneous recovery, the old behavior just reappears. So Brian putting his head on his desk would just reappear. Resurgence occurs when we've put the replacement behavior on extinction as well. And that's what we did here. We taught the replacement behavior, but then the teacher now withheld reinforcement extinction for keeping his head up, the replacement behavior. As a result, Brian is now putting his head on his desk again. So when a behavior reappears because the old behavior and both behaviors are now on extinction, we consider that resurgence. You have to understand the technicalities, the difference, right, between resurgence and spontaneous recovery. 33. Dave's dad shows him a band called ZZ Top. The members of the band have huge white beards. Now, whenever Dave sees a man with a big beard, he says ZZ Top. This is an example of what? I like this example to illustrate this point, right? Because it's very visual. Okay, ZZ Top, a lot of guys with big white beards. Okay, they have these huge white beards. They all look very distinct. So Dave now sees a man with the big beard. And what does he say? ZZ Top. So he sees the band member ZZ Top. He sees the guy at Target ZZ Top. He sees the guy at the park ZZ Top. All these different stimuli are getting the same response. What do we call it when we have the same response across multiple stimuli? A, response generalization. Response generalization occurs or involves multiple responses. We have one response, right? ZZ Top. What Dave is doing is generalizing across stimuli. All these guys with big beards are now ZZ Top. It isn't maintenance, right? It isn't maintaining it because Dave's dad didn't teach him that all these different guys were ZZ Top. He just showed him members of the band with white beards. Dave is simply generalizing across stimuli or stimulus generalization. 34. The principal brings in a guest speaker to teach staff about positive behavior support using reinforcement. After the lesson, Joanne attempts reinforcement, but resorts back to reprimands and timeout after reinforcement isn't effective the first 2 tries. Joanne has resorted to what? This is a very common situation you might face when working with stakeholders. We know that ABA is a process. It takes time. Sometimes it takes a lot of time. Sometimes it's hard. People who don't normally deal in ABA, right, stakeholders, aren't always as patient as us. So what do? Well, they go back to what works. Punishment, right? Timeouts, reprimands, spankings. Things they know will reduce the behavior in the short term. We know in the long term it's not going to be beneficial, but in the short term it gets the job done. So they've resorted back to that. Joanne, right, she was taught positive behavior support using reinforcement. So she attempted it twice, not very much, but then said, okay, you know what? It's not working. Let me just use reprimands and timeout. I know I can decrease behavior that way, or I can change behavior that way. So what does she resorted to? A, mentalisms. Mentalisms are hypothetical constructs, explanatory fictions. No, reprimands and timeout are interventions, right? They're just a certain type of intervention. B, default technologies. Yes. When somebody resorts to something like a reprimand or a timeout, we consider that a default technology, right? Just traditional ways of handling behavior. Reprimands, timeout, spankings, restitutional punishment, these type of things. They're just default technologies, okay? And Joanne, really not giving reinforcement a chance, has just resorted back to the default. What about negative reinforcement and negative punishment? Well, reprimands is a positive, so it can't be either of those, right? And she's given up on reinforcement. She's resorted back to the default technologies, even though she hasn't even given the time of day to a alternative ABA strategy like reinforcement. Tara is scared of dogs. Yesterday, someone yelled Tara's name, and at the same time, Tara saw a dog and her heart started racing. Now, when Tara hears her name, her heart starts racing. How could this be put on extinction? Interesting question, right? Talking about extinction. Well, we know we have operant extinction and respondent extinction. Operant extinction is what we normally deal with withhold reinforcement. Respondent extinction, there is no consequences, okay? So what we need to do is basically prevent the reflex from happening, all right? So in this case, we know Tara is scared of dogs, okay? So she's scared, right? Yesterday, someone yelled at Tara's name at the same time, Tara saw a dog. Tara's name is neutral stimuli. Tara seeing that dog, right, is the conditioned stimuli. So her heart started racing, which is the conditioned reflex. Now, when Tara hears her name, her heart starts racing. So her name has become a conditioned stimuli, and her heart starts racing is still a conditioned reflex. So a conditioned stimuli created another conditioned stimuli. How can we put that on extinction? Well, we're going to have to separate her name from the dog, right? So we need to present her name to the point where her heart isn't racing anymore. So A, withhold reinforcement for when someone calls Tara's name. Well, we can't withhold reinforcement. This is a respondent extinction procedure. We're not dealing with consequences. B, present the dog while someone says Tara's name over and over until Tara's heart no longer races. We're not trying to do this with the dog, right? And if you're going to do respondent extinction, you only present one of the stimuli to try to get rid of the reflex association. B or C, have someone say Tara's name over and over until the heart no longer races. Yes, we have to present the conditioned stimuli. Here's her name until the reflex no longer occurs. That is respondent extinction. So have someone say Tara's name over and over until her heart no longer races. 36. Which of the following answer choices best demonstrates a hypothetical construct? Now, hypothetical constructs are one of our mentalisms. Circular reasoning and explanatory fiction. So let's talk about hypothetical constructs versus explanatory fictions. The hypothetical constructs are the terms we prescribe to let's call them internal events, right? Things like frustration, stress, and ego and confidence. These are hypothetical constructs. Explanatory fictions are when we use those constructs to explain why behavior occurred. Now, here's where people get it confused. We're not saying those things don't exist. We're just saying we're not going to attribute cause to those things. So we're not going to attribute cause to confidence or ego. Okay? So we're looking for the hypothetical construct, meaning we're looking for the term. A, Greg does not go near dogs because he was bit by a dog when he was little. Well, why doesn't Greg go near dogs? Because he was bit by a dog when he was little. That is not a hypothetical construct. That is an observable, measurable thing. B, James gets severe test anxiety before a test. There's no cause here, but test anxiety. That's a hypothetical construct. C, Robert has no money because he's lazy. Okay. Well, this is a causal thing. This is an explanatory fiction. The difference between B and C is in B, there's no causal. In C, there is. Because he is lazy, he has no money, is an explanatory fiction, using the construct to explain the behavior. And then Alicia is happy because she just saw a shooting star. All right, why is Alicia happy? She saw a shooting star. Perfectly valid, perfectly reasonable. The hypothetical construct here is this severe test anxiety, right? This is the construct. Now, if we were to say James failed his test because of test anxiety, that is an explanatory fiction. That causal reasoning makes it an explanatory fiction. 37. Elliot is a certified behavior analyst. He operates an ABA clinic and has several clients. He recently became certified in mindfulness meditation practice. He is now offering mindfulness meditation practice and ABA on his website. What else must Elliot do? The ethical code has very specific guidelines for representing ABA and advertising non-ABA services, right? In this case, he's a behavior analyst, operates ABA clinic, and now he's certified in mindfulness meditation, which is not an ABA practice. Can he use them in conjunction? Yes, but he needs to separate them. How? Okay, what must he do? A, Elliot cannot advertise meditation alongside ABA services. Not true. Okay, he can advertise these at the same time. B, Elliot is certified, so he's able to advertise both services on his website. That's true, but he's missing something. What is he missing? C, Elliot must add a disclaimer next to all mindfulness interventions. Yes, In the ethical code, they list the disclaimer that Elliot must use next to his mindfulness interventions to make it distinct what are ABA practices and what aren't. D, Elliot must choose either ABA or mindfulness. He cannot practice both. Not true. He just can't misrepresent ABA as mindfulness meditation or vice versa. The two things need to be very distinct. And there's a disclaimer that they want you to use inside the ethical code. So Elliot needs to hunt down that disclaimer and add it next to all his mindfulness meditation ads. 38, Elizabeth wants to learn how to be a better cook. She signs up for cooking classes and starts to see improvement. She also watches cooking shows on YouTube and practices at home. If the independent variable is cooking class and the dependent variable is Elizabeth's ability, what are YouTube videos in practice relative to this design? Again, long question, right? So much information. Slow down. Do your work in the question and then go to the answer choices. We need to know what? We need to know what are the YouTube videos in practice relative to this design. We know the independent variable is cooking class. This is what we are manipulating. We know the DV is ability. This is what we're measuring. Elizabeth signed up for cooking classes, started to see improvement. She watches cooking shows on YouTube and practices at home. Okay. So she has these other things going on. Even though the independent variable is cooking classes, she's got cooking shows on YouTube as well. So how can you say for sure that the independent variable, your manipulation, the cooking class, is impacting Elizabeth's ability and not the YouTube and the practicing at home? That's what the question is getting at. So what are YouTube videos in practice relative to this design? A, also dependent variables. They are not dependent variables. We are not measuring her YouTube time and her practice. We're measuring her ability. D, also independent variables. They're not. We only listed one independent variable, cooking class. So if they're not IVs and they're not DVs, well, they've got to be extraneous variables because extraneous variables are everything else around you. And they are potential confounds. So what makes them potential confounds? Well, potentially, they are hurting your design. They're hurting your functional relationship. They're hurting your experimental control. If I want to prove that cooking classes increase ability, well, Elizabeth going home and watching cooking shows on YouTube and practicing at home are just hurting what I'm trying to demonstrate. They're potential confounds, and they're also extraneous variables. These questions are difficult because as most of you are practitioners, you don't deal in research, but you've got to understand what this question is implying. We have an IV and a DV. These other things are just extraneous. And now they're affecting your experiment. They're probably confounds. Of the following, which one is not an appropriate reason to discontinue services as laid out by your service agreement? What I really like in the new ethical code is they have listed specific reasons for terminating services. It isn't ambiguous. It's right there in the code. Okay. This question is, what is not an appropriate reason to discontinue? A, stakeholders are not complying with interventions despite addressing barriers. This is new. If they're not complying with interventions and you've tried everything, we're not saying because they don't want to use one intervention, you have to fire them. We're saying you've tried everything and they're still not doing it. B, insurance is no longer funding the services. If funding goes away, if they can't afford it, if there's no money, you're under no obligation to continue. C, the stakeholders are unable to implement an extinction procedure with fidelity. Well, that's no reason to discontinue. Maybe you didn't train them well enough. Maybe extinction isn't realistic. The difference between A and C is in A, they're just not complying. They're not trying. With C, maybe this is the first thing you've tried. Maybe you haven't trained well enough. Maybe they're not suited for extinction. There are a lot of barriers left untold in C. And then D, the behavior technician is exposed to harmful conditions within the household which are not resolved. Yes, if you or the technicians are exposed to harmful conditions which are not resolved, you can discontinue. So, laid out by the service agreement, which one is not an appropriate reason to discontinue? Well, just because they can't do an extinction procedure with fidelity doesn't mean you can fire them. And then 40, pretty simple one. Who is the father of behaviorism? The reason I put this in here is because people get confused between Skinner and Watson, right? Skinner is radical behaviorism and verbal behavior. Watson is behaviorism. Pavlov is Pavlovian conditioning, classical conditioning, and Cooper wrote our white book. Who is the father of behaviorism? Watson. All right, check out behavioranalyststudy.com for all of our study materials. Like, subscribe, let us know when you pass. Hard, study hard. See you soon.